Good morning and thank you for joining us. Teresa is not here today for the YouTube session. I will now report our daily case counts. We now have a total of 14,965 cases, an increase of 72 cases from yesterday. Of these 72 new cases, 29 of them are close contacts of a confirmed case, 5 are community acquired, 3 are outbreak related. We currently have 486 cases of COVID-19 that are active in our region. 29% of them are VOCs. Among the cases reported in Windsor-Essex, 590 of them are variants. 590 of these cases are variants of concerns from the UK variant, and 2 are from the South African variant. Unfortunately, we lost 411 people from Windsor-Essex due to COVID-19 diagnosis. 27 COVID cases are currently now in our hospital system. With respect to vaccine, we have now vaccinated a total of 127,056 of the Windsor-Essex residents who have received at least 1 dose of the COVID vaccine. Our case counts continue to fluctuate between 50 to 70 cases a day. This is still a pretty significant case count for our region of our size. With the variant cases on the rise, this number can increase very quickly and can push our region in a very difficult spot. It is absolutely critical that we continue to follow all public health measures. We are noticing an increase in cases at the workplaces now. With many businesses currently closed or operating virtually, it is important for the businesses that are still open and have staff on site to follow the strict public health measures. All employers should look for ways to allow their worker to work remotely to prevent any transmission at the workplace. Workplaces should review their COVID-19 plan and update it with most recent guidelines to keep their workplaces safe. With the variants of concerns on the rise, cases can increase rapidly, especially in the workplace, and can potentially lead to closure of the workplace, which may have an impact on the businesses. Please continue to follow all public health measures to ensure the safety and well-being of yourself, your family, your workplaces, and for the entire community. Thank you.
We'll now take questions from the media. Today we'll start with CTV.
Yes, good morning. Did you expect to see fewer cases by now, considering that the stay-at-home order has been in place since April 8th?
Well, yes, we expected to see that, but sometimes the measures that started to take place, it may have already resulted in exposure and transmission. I think the biggest question mark continues to be the long weekend that we had, the Easter weekend, and what kind of transmission could have happened in that weekend, and then seeing the impact in the coming weeks. With the variants of concerns with more close contacts that we are seeing, again, that's also a function of the variants of cases increasing in the region. So we are not so far behind from the rest of the province with respect to the variants of concerns showing up in our community. And that's why it's important that we all take that opportunity to still do our best and limit the number of close contacts. But yeah, you are right. At this time, we should start to see more progress. But at least on the flip side, we are not getting worse. I think that's the kind of silver lining, if we want to call it. But we are inching closely to higher cases every day, which is a concern for us.
And how concerned are you with the workplaces? Do you think it'll reach a point where you have to issue a separate order?
Yes, we are seeing some cases, but most of these cases still are not resulting in a major transmission risk at the workplaces. Generally, there are cases and then they are contained. And if it increases up to a certain point where we are concerned about the safety of the workplace, then we'll have to shut down the workplace, but we're not there yet. And that's why I wanted to make sure that we take this opportunity to remind the workplaces to maybe review their practices and protocols just to ensure the safety and well-being of their employers and also the safety of their workplaces.
Okay, thank you.
Any questions from CBC?
Yes, good morning. Has there been any indication from the province that we're going to see additional vaccine supply, given that the federal government is saying that Pfizer is going to be stepping up with more vaccine?
Well, we know that the federal government will be receiving more vaccine in the coming months, in the month of May and June. We don't know how much of these vaccines will come to Ontario and how much of these vaccines will come to our region. But we are aware that we will see an increased supply of vaccine, and some of these conversation and discussions are ongoing. We don't have a set number or allocation formula or anything like that at this time that would help us to say with certainty that how much of those additional vaccines we will get.
Oh, sorry, I was on mute. Do you have a goal in mind for how much you'd like to see?
Well, I think we want to vaccinate our residents as quickly as possible, and recognizing that there are other hotspots, other regions that are struggling more with the cases. So we'll have to think like a system and a province, and also look into our region as well. We do have more capacity to administer vaccine in Windsor-Essex. Right now, we are administering anywhere between 3,000 to 4,000, depending on the supply that we have. And some days it goes down to 2,000, depending on, again, the supplies. So we do have a significant capacity that we can ramp it up to, even if we can get to, I don't know, like 6,000, 6,000 doses a day. That would lead us to at least anywhere between 30 to 40,000 doses a week. So which would be something that we should be able to manage, and but it all depends on how much supply we can get from the province.
Thank you.
Any questions from Blackburn?
Yes, good morning. I noticed, I'm just looking at your website here, I noticed that you have a new chart kind of putting out the vaccination rate per, like, on the map. And they range anywhere from about 20% to 31%. How do you feel about the coverage rate throughout Windsor-Essex? It's pretty, I don't know, I would say, I mean, equal would be a good way to put it. Why do you think this map is important to, provide that information to the public?
Well, I think it's just part of the first of all, the disclosure piece as well, that we want everyone to be aware of, that which are the areas that we're getting a more uptake. It's also helpful for our planning purposes as well, so that we can maybe do more targeted campaign in these areas where we are having a slightly lower vaccine uptake, and if we need to do something differently, if we need to maybe target them differently. So all of those information are helpful, and as a community, we are getting lots of people vaccinated every day, which is important, but also we have to make sure that we are bringing everyone along with us, and not leaving one region or one area behind in terms of the vaccination rates.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. And when you talk about cases in the workplace, are you seeing any trends for the cause of transmission? Is it people knowingly coming to work sick because they can't afford to stay home, or are there just some lapses in IPAC measures that just need to be more strictly followed?
Yeah, I don't have any indication at this time that if people are intentionally coming to the workplace knowingly sick. There are some odd instances, but generally speaking, that is not the case. It's more of people either in their like very close to their infectious period without necessarily realizing that they are a case, or if they have been identified as a close contact and then they convert into a case, and sometimes we can't really pinpoint how they contracted it. But generally speaking, that is not the case. We are, so far, people are taking it seriously, but making sure that even if a case enters a workplace, the workplace have good systems and protocols in place to prevent any further transmission.
So our investigation seeing that there is some form of lapse in IPAC measures then?
Yeah, it happens, and I think that's why it's important to continue to educate your employees, the workplace, and everyone else to continuously update policies and enforce them. And so these lapses, these happens. I think it's just part of that. But as I said, because it's not resulting in any major spread, which is a good sign, but we shouldn't let our guards down just basing on that, and continue to look for ways to, first of all, let your employees work remotely if possible. And if they're coming to work, making sure that you have all the good policies and systems in place to prevent any transmission at workplace.
Thank you.
Any questions from AM800?
Dr. Ahmed, just going back to the vaccine and the distribution of the doses. Yesterday, a total of 136,289 was reported, and today I just added it up, it's 140,510. So does that mean yesterday more than 4,000 people received a single dose? Is that how it's being calculated?
Great question, Rob, and I'm glad that you are paying attention to the numbers. In theory, yes, but part of that is we're also doing some data cleanup with all the vaccination sites. And sometimes after the cleanup, we find some of these cases that were not earlier captured. And now they are, as part of the data cleanup, they're captured into that system of reporting in terms of how many people got the vaccine. So that's why you may see some fluctuations even in the coming days, that that there may be increase or decrease in the number of doses administered, but it's all as a part of data cleanup that's happening right now.
I guess if we use that 4,000 number in just one day, that seems very, seems like a good number. Are you pleased with that number, 4,000? Obviously, like you stated before, your goal is to get as many of the vaccine in people's arms, but 4,000 a day seems pretty good.
Yeah, no, absolutely. 4,000 is a good number for the region of our size. And again, it's a combination of all these mass vaccination sites, pharmacies, as well as our primary care providers that are delivering the vaccine. So we, as a system, we do have additional capacity. Not all of the primary care providers are vaccinating at this time. Not all the pharmacies are vaccinating at this time. So if you're looking at a system capacity, we do have more capacity. If we have more vaccine, we can use more pharmacy channel to give out the vaccine. We can use primary care channels to give out the vaccine, and then continue on the work with our mass vaccination clinic. So our region has a pretty good capacity to administer vaccine. And if we can administer 4,000 vaccine a day consistently for 7 days, that's 28,000 doses a week, which is not the supply that we are receiving. So we'll have to wait for additional doses, but clearly I think our health system partners are really working hard to vaccinate our residents as quickly as possible. And I can't emphasize much that without the amazing partnership that we have with our municipalities, Windsor Regional Hospitals, and our health system partners like the primary care providers and pharmacies, we wouldn't be here. And we'd like to continue to build on that relationship, and it will come really handy, especially when we start to offer second doses. And so that's all the planning that we are doing right now to leverage the existing capacity in the system and use it best to give out the vaccine as quickly as possible to our residents.
And finally, when it comes to the pharmacies, I know it's only been a day, but do you know how it went yesterday with the 40 and over? Was there a good turnout of individuals 40 plus?
I don't have that specific detail, Rob. I didn't hear anything from our team, whether there was a good uptake or not, but I did hear one of your host from the morning show got the got the AstraZeneca vaccine yesterday from the pharmacy, so which is great, because we definitely want people to get the first vaccine that's available to them, to maximize our protection and to get ahead of this pandemic and get everyone protected.
Thank you.
Any additional questions from CTV?
No, thank you.
Any additional questions from CBC?
No, thank you.
Any additional questions from Blackburn?
No, thank you.
Any additional questions from the Windsor Star?
No, thank you.
Any additional questions from AM 800?
No, thank you. Have a good day.
Thank you, everyone.